So let's end this session by talking about other long-term care services that are available out there. The first one is respite care. So respite care is more of a concept, more of a philosophy. And by the way, before I proceed, when we talk about other long-term care services, these are long-term care services that can either be classified under both community-based and institutional or neither. And in this case, respite care is really neither a community-based or an institutional-based long-term care service because, like I said, it's a concept, it's a philosophy. It's meant to provide temporary relief, um, uh, from a family member that is basically giving the continuous 20, maybe 24/7 long-term care service to a family member. So that particular caregiver gets temporary relief from their caregiving responsibilities, and the goal is to prevent caregiver stress and burnout. So here, the the focus of the service is not necessarily the client, but the family member who's a caregiver. The next one is restorative care, or also known as rehabilitation. And restorative care simply means therapeutic interventions that are designed to help patients regain or improve their functions. And treatments are rendered by licensed therapists. So this would include uh, therapists, recreation therapists. And like I said, we do have a program for that in the college. There's also what we call maintenance rehabilitation, which preserves existing function and prevents further decline. And then there's also what we call adaptive rehabilitation, which improves function despite deficits that remain. So these are really intensive, but done on a short-term basis. And it's done by licensed professionals. Next is hospice, or also known as end-of-life care. Um, we have also mentioned in outpatient care that hospice care can be given in an outpatient setting. Now, this are for people who are terminally ill with a life expectancy with a prognosis of about 6 months or less left to live. So it is still considered long-term care. It could, because it's probably expected it would be more than 30 days, but the life expectancy is about 6 months at the most. Hospice care is basically a cluster of services designed for the terminally ill. And end of life care can be a part of home health, as I've mentioned, when services are provided in the patient's home. Now, there are hospitals that do hospice care. There are specific hospice care centers. We do have one in here in New York, in the Bronx particularly. It's called Calvary Hospital. It is actually a hospice care center. Retirement centers or nursing homes could actually be, could also provide hospice care. Now, it is a method of care. It is not a location, though there are freestanding hospice facilities that have been established, such as Calvary Hospital, as I have previously mentioned. So before we talk about some other facts about the nursing home industry, let's remember that the Affordable Care Act, or Obamacare, has actually had provisions that have a wide-ranging effect on the long-term care industry. And in this case, states have the option to provide home and community-based attendant services under Community First Choice, which increased federal funding, matching funds for Medicaid, and this is what allowed part of this funding is the one that funds Medicaid recipients who receive care from family members, and in return, the family members are actually reimbursed for that service. And the Affordable Care Act also uh, basically subsumed a previously uh, conceptualized law, which is called the Elder Justice Act of 2010. So it was just made a part of the Affordable Care Act. And ACA also um, mandates that all certified facilities must comply, and they should have a program for quality assurance. So the number of nursing homes, bed capacity for nursing homes, and the number of residents, and even occupancy rates in these facilities have continued to decline. And this is mainly because of the growth of community-based options. So a lot of people requiring long-term care services who do not or who still have high levels of independence actually stay in the community and receive long-term care services via community-based long-term care um, services. Um, Medicaid is the main source of financing for nursing home care. So Medicare Part A will only pay for a part of the inpatient stay in nursing home. But for those people that have Medicaid, Medicaid then kicks in after the coverage for Medicare lapses. And for those who do not have Medicaid, well, it comes from their bank account. So a prolonged stay in a nursing home, if you don't have a secondary insurance that could pay for it, would actually bankrupt someone. Um, but for those who have are dually eligible for Medicaid, Medicaid steps up to the plate, and therefore Medicaid ends up being the one that shoulders the expenses for the most part. Um, Very few people have long-term care insurance policies, though. It's very expensive. It could be cheaper if you get it when you're young, but the premiums, are relatively expensive if you start getting it in your 60s or even in your 50s. So if you want to think about long-term care insurance policies, they recommend that you get it like in your 30s or 40s, um, which a lot of people don't think about retirement during that time yet. Um, there's also this phenomenon where people would actually divest themselves of resources, such as uh, uh, bank accounts, money particularly, and they basically give it to family members. However, there's a law also that you should have divested yourself for 5 years before you can actually qualify for Medicaid. So just to do a little bit of a rundown and some conclusion, we all need to remember that long-term care is not an isolated component of the healthcare system. It needs to be blended in with the entire healthcare delivery system, and that it includes medical care, social services, and housing. So it's not just clinical care, which is usually comes to mind when we think about nursing homes. Now, the range of long-term care services also need to be adjusted according to the needs of the client. So each client, each patient have their own needs, and that is why we have different types of long-term care services, be them as it may be, that they are community-based or long-term care. So it depends on what the needs are of the clients. And the biggest predictor for the need for long-term care is the impairment, which leads impairment in self-care capabilities, which can then be measured with ADL and IADL scale. And the more impaired an individual is, the more dependent they are for self-care, thus precipitating the need for long-term care. Now, another concept that we have talked about, which is quite important, is respite care. So respite care is meant for informal caregivers. It is not meant directly for the clients of long-term care. It is meant for usually family members who don't receive reimbursements. But community-based long-term care services help provide respite care. And so basically, some children perhaps with disabilities would go on a respite care center for the weekend, and then the family member who takes care of that child or that individual who probably have development disabilities will have some rest. And we have also talked about informal care that is being supplemented with community-based services. And when the level of dependence or the level of independence declines, it then determines whether the services would require intensive attention and care, which then leads to long-term care in institutional settings. Now, long-term care facilities range from those, providing, especially the institutions, basic personal care to very complex specialized care. We talked about that when we discussed institutional settings for long-term care. And hospice-based end-of-life care is also considered a part of long-term care. Now, it's basically a method of care, as we said. It is considered part of long-term care, but it is also considered an outpatient service. That concludes this session. You may now take the quiz after this lecture video.